Greg Harper, or should we say Dr. Greg Harper, standing by.
Greg's Anatomy.
I just thought I heard that, paging Dr. Harper. Probably not, though. Gentlemen, we are here at Langara College. Did you know that this week is National Nursing Week? Because of this, we're going to find out what our future nurses are being taught. We're here at Langara College in Vancouver. We're going to join some students as they learn, some just about ready to become nurses. And you wouldn't believe some of the technology at work here today to teach some of these future nurses. We're going to cover as much as we can this morning. Coming up, and yes, I've got scrubs on.
Looking really good in the scrubs. I like it, Greg Harper, and I like Thor's little spin. Greg's Anatomy. Can't wait to see more today. That's awesome. Thanks, Greg.
Really? Mm-hmm. And my sister is a nurse as well, Dawn. And by the way, welcome back. I know you were in New York last week. Hope you had a good time. We'll talk about it after. We are here at Langara College in Vancouver this morning. It is National Nursing Week. We are going to learn what some of our future nurses are being taught. It starts with assessing the patient. We'll get into that coming up, Mark.
All right. Looks very interesting. All right, we'll check back with Greg and the nurses in just a couple of minutes.
Here, but first, it is National Nursing Week, so Greg Harper is over at Langara College celebrating of sorts. And I like I mean, you look the part here, Greg.
Thank you. I always try and look the part, Riaz. Yeah, good morning. Yeah, I'm wearing scrubs here. We are here at Langara College in Vancouver. We have some nursing students behind us. We have the department chair here, Janine Lennox, with us here this morning. Thank you for having us.
You're welcome.
So let's start with how you're educating these future nurses on assessing patients. How does that work behind us? What's going on?
Well, what's happening here behind us is we have two groups of students. This group is assessing a patient, performing a head-to-toe assessment, and this is on a medical patient. And then this group over here is performing post-op assessment, head-to-toe, on a patient who's had abdominal surgery.
Okay. These students here, how long have they been in the program?
These students are going into term 5.
Okay.
And
how many terms are there?
There's 10 terms.
10 terms.
Yeah.
It's 4 years then.
Just
I'm
about
guessing.
4 years. We go continuously. So they don't have a break. So 10 terms is actually a little bit less than 4 years.
How many students do you accept each year here? And how does that whole application process work? What are you looking from people?
We accept 80 students twice a year. So we have a September group coming in and a January group coming in. We have admission criteria, and we have just raised our admission criteria. We closed our admissions process for a period of time while we were getting that all arranged, and we will shortly be accepting applications for September 2013 for students to come in.
Okay. I just wanted to get some basic knowledge here this morning before we get going. I like to get involved in the live eyes that I do periodically. I like to, interaction.
Right.
So you're going to have me doing stuff, right?
Yes, yes, we will.
Okay, I'm looking forward to this. Plus, we're also going to learn about a special patient they have in another room. The technology nowadays, it's a lot better. We'll get into that coming up. I believe I'm going to Good morning. It is National Nursing Week, and because of this, we're at Langara College in Vancouver learning all about the nursing program. More of this coming up, Thor. Okay. Welcome back, 7:08 on a Monday morning. We're here at Langara College in Vancouver today because it is National Nursing Week, and we've got some nursing students in here. We have a nurse educator right here, Heather. Good morning to all of you. Good morning. We have a patient here. There's a bit of a wound. So how do we clean this wound properly?
Okay, it's very important that we set up the sterile field. And once it's set up, of course, we're going to use normal saline to cleanse the wound, which has already been poured into the dressing tray. Then we're going to clean the wound with a 2x2. It's very important to keep your forceps pointed down.
I didn't know that. I grabbed the forceps to begin with like this, and I immediately got scolded.
Yes.
Why not hold them like this?
Because we don't want the germs to travel down. So we want to keep everything down like this. And then we're going to use normal saline.
You have a very soothing voice, by the way, Heather. It's very nice on a Monday morning.
And our patient here is Carl. And of course, before we perform the dressing change, we're going to make sure that Carl's had something for pain, which he has. And we're going to clean from clean to dirty, top to bottom, and the inside of the wound like this.
Okay. So we won't actually cover the whole cleaning process because we don't have enough time. We have 2 students here as well that are going to dress this patient.
Yes.
So what are you looking for in your students that have to dress a patient?
Charin and Nicole are very skilled at performing dressing changes. So once the wound has been cleaned, they will of course continue to maintain a sterile technique, and now they will dress the wound with the appropriate material that's been ordered to apply on the wound. And Charin is using what we call Mepapore to apply over the wound.
How much of the nursing program here is practical? How much of it is the classroom?
Well, it's divided up quite nicely where the students actually are in class on often Mondays, and then Tuesdays and Wednesdays they're in clinical, and then they will return to the college and classes on Thursdays and Fridays.
Okay, Heather, thank you very much.
Okay.
I'm very relaxed right now. Very soothing voice. Your students are in good hands. Okay, Michelle, coming up, lots more here about the nursing program, including a patient in the next room that talks to you. It's not a live patient. We'll get into that next.
Okay. Greg Harper standing by in the live eye. Let's go to the man.
Good morning, boys, ladies and gentlemen. This is Vincent, human patient simulator here at Langara College in Vancouver. We are here because it is National... He just coughed. He's coughing right now. We are here because it is National Nursing Week, so we're learning about how all our nurses are educated. Stop coughing. Okay. Pretty interesting. So how does this work?
This man was someone that we purchased from a company, and we have a software program. We can actually program him to simulate various disease entities, health challenges, and we also have the ability to modify some of that so that the instructor who's in behind this window here can actually make some different decisions and program different symptoms for the patient, for the students to think critically about what's happening with the patient, what are they going to do. It's a safe environment for the students to practice in, and it simulates the clinical practice setting, helps them develop teamwork, collaboration.
It's pretty incredible how technology has changed here. What would you like me to do?
Well, I think you did a good thing in raising the head of the bed. He was coughing, and Vincent has been having some trouble breathing.
More.
Yes.
There we go.
Okay.
Okay.
There's a few other things. That's one of the first things that nurses would do. And because he has a history of COPD, we'd probably like to, if you take a look here, his oxygen saturation is very, very low. And we can monitor that. You might like to put that on.
Sure.
For the experience.
What the pointer finger?
That's right. That's right. Any finger is fine.
Okay.
That's good.
Yeah.
And one of the things we're going to do, we've raised the head of the bed. Maybe we can apply some oxygen now.
Okay. In through the nostrils, I'm guessing,
right.
not the ears. Okay. There we go. How you doing, Vincent? Doing all right? He's not coughing anymore, so I think that's good.
That's right.
A little bit creepy, but this is obviously an important tool for our future nurses, isn't it?
It is, absolutely. And we're hoping that his oxygen saturations will go up a little bit with that oxygen. He says it's helped.
It's helped.
Yes.
So there's many different scenarios that you can do with him, right?
There is,
and
yes.
you keep the students guessing here, correct?
We
I'm
do. We
imagining?
can change the scenarios, and then it helps them to think about what they would do with an actual patient who is experiencing these symptoms.
Okay. Very interesting.
Yeah.
Thank you very much.
You're welcome.
Riaz, we got a lot more coming up here as I go to a nursing school this morning. Are we all cool now, Vincent?
Looks good.
I think we are.
Okay,
Hearing
Greg.
nothing is a good thing.
Greg Harper standing by in the live eye.
Good morning, boys. Here at Langara College in Vancouver, it is National Nursing Week, so we're learning all about the program here this morning. I got Mary, one of the educators, here with us. Coming up, I'm going to learn how to give a flu shot. That should be interesting, Mary. You're watching BT. Stay with us. I think the heart rate sounds okay here.
Yes, it does.
Yeah. Thank you.
Well, you may have to be in the hospital after hearing this whole song, but it's Judas by Lady Gaga at number 5 on the iTunes pop downloads. Pitbull's at number 4 with this song, I tell you, give me everything. Bruno Mars is number 3 with the Lazy Song, LMFAO, Party Rock Anthem. Forgot the Y in there, sorry, number 2. And Rolling in the Deep by Adele is number 1.
Greg Harper standing by in the live eye all morning long. One last time, we'll check in with the man.
Yes, good morning, Riaz. We're having all sorts of fun here at Langara College in Vancouver. Isn't that right, ladies? Yeah. There we go. We are here because it is National Nursing Week, so we're learning all about the program here at Langara College in Vancouver. A little bit of a warning here. If needles make you a bit squeamish, just be aware of that because they're going to educate me right now, Suki, on how to give a flu shot. So how do I do this?
You're going to start by cleaning the orange.
The navel orange?
The navel orange.
Yes.
So just
Okay.
clean it
With
in
an
circular
alcohol
mode.
swab.
Yeah.
Okay.
Yeah. Okay, that's good. Now let it dry and get
Okay.
your needle ready.
Can I blow on it? Or?
No.
That wouldn't, no,
No,
wouldn't be
that
good.
wouldn't be good.
Okay.
No.
All right.
Okay,
So
so take the cap off. pull it off. That's
Okay.
great. Put that down. Now you're going to inject it at 90-degree angle.
Okay, how do I inject
Just
this
dart
properly?
it in.
Just like
So
a-
hold the orange with one hand, with the other hand.
How do you deal with people that are nervous getting needles? People like myself.
Well, we sit you down and then we talk you through it, and before you know it, we give you the injection.
You
Yeah.
maybe try and distract
Yeah,
the person
yeah,
too, right?
Yeah, so hold on to the orange, talk to the orange,
Yeah.
and then just dart it in.
You're a nice looking orange. Here we
Great, go for it. That's great. Now squeeze the vaccine
Like that?
in. Yeah, wonderful. Take it out, put the needle in there,
go. Yeah?
and now with this, press on it. That's it. Excellent. You did a great job.
Did that work?
Yes.
What the heck's going on over here behind me? Skeletor behind me. Okay, Mary, I know there's a lot taught here at the college, and you were saying before we just went on the air here that research is a big part of being a nurse. You teach that as well, right?
That's right. We teach research to students so that they're able to read articles, current articles on various topics about disease processes and nursing care and medical care and practice guidelines. And they use those guidelines to make sure that their care is up to date when we give the care. So incorporate that. So nurses need to understand the research process and keep on reading current literature on
It
the
never
topics.
stops.
It never stops. That's the whole focus of being a professional.
Thank you very much.
Most
You're all
welcome.
very professional here this morning. Thanks again. It's a very intense program, a good one here at Langara College in Vancouver. You can go to the website for more information. 3 years and 3 months nonstop, Dawn, and then they're all ready
Well,
to become nurses.
I'm impressed with
Learned a
your
lot here this
bedside
morning.
manner. You did a great job. I don't know if I'd want you, poking me with a needle, but hey.
Thank you. I'll give you a
Nice
round of
job there,
applause.
Greg. Thank you very much, and congratulations. All the nurses out there. As I said, my father has all his sisters are nurses, so congratulations to everyone out there. We'll take a look at our weather forecast right now.